All right, well, it is time to upgrade your face mask. That is a recommendation from the Centers for Disease Control.
All right, amid the highly transmissible Omicron variant, the CDC says a cloth mask just is not cutting it. And you should shift to an N95 mask or a KN95 mask when possible. Joining us this morning with recommendations, the director of Rutgers University Center for Advanced Biotechnology and Medicine, Dr. Martin Blaser. Nice to have you on. Good day.
Good morning. Nice to see you.
So, Doctor, about a year ago, I had the Surgeon General on, and he actually showed us how to make a cloth mask at home. I am so confused now. We should not be using those cloth masks at all?
You know, my view is that any mask is better than no mask, but there's a degree of how good masks are. Here's my little surgical mask, which I use all the time, and that's good for 95% of situations.
Okay, so the surgical mask is good. I like the surgical mask because the N95, I can't breathe with. Am I the only one who has that problem?
No, that's a common problem. It's really mostly for people in high-risk situations, like healthcare workers who are with a lot of people, some of whom are infected. That's who we should mostly have KN95s or N95s for. But for most people, surgical mask is fine. And one of the reasons that the CDC is changing policy is that the world is changing. This Omicron virus is much more infectious than the earlier viruses. So a cloth mask isn't fully protective. It's better than no mask, but it's not as good as a surgical mask.
So they're not telling everyone to go out and throw away their cloth masks. They're saying some people should be wearing those higher grade masks. So what is the reasoning for saying that? Because they could say absolutely throw away the cloth masks and switch over to the different masks.
Yeah, I think it's prudent to use the surgical mask as much as possible. If you're in a situation where you're with other people, you want to be protected. And as everybody knows, this Omicron virus is extremely infectious. So when I'm with other people, I'm wearing a surgical mask.
And what about spotting counterfeit KN95 masks? Because from what we're hearing, 60% of them are not even the true KN95 masks. So how can you find the right one?
Yeah, I mean, counterfeit is a big problem. I agree. I mean, it's unconscionable, but people are doing it. Again, I don't think you'll get into too much trouble with the surgical mask. That's what most people should use most of the time in situations when they're with other people. And again, if there's no mask, a cloth mask is better than no mask.
You know, it's expensive, these masks, I will tell you, and sometimes hard to find since that supply chain problem is happening. I go into my drugstore, and some weeks there's not a mask to be had. What do you do? Can you reuse the mask that you have?
Yeah, you can use these masks for a long time. I find that the straps keep breaking, and I have to kind of make a little knot and make a hole and just to make it work longer. And it's also taught me to be a lot more careful with these masks than I used to be.
What about children? Should they be having the higher quality masks, the N95s, because they're around kids and, you know, for them to keep their territory and barriers a little bit more difficult?
I think it's not that practical. I think, again, for kids, surgical mask is the best thing, like you're showing in this picture.
Got it, because I feel like that probably is just one more thing that the CDC is saying is which mask can you wear longer? And clearly something that's more comfortable is something that you can wear longer.
Sure. This got to be, we need practical advice in the face of an epidemic that keeps changing. So we have to change the advice.
And I guess that's why we've had conflicting information on the masks, because if you remember from day one, they told us we didn't need a mask. Then we were making our own masks. Now we need a certain kind of mask. Yeah. And I can only imagine what will happen in a few months from now, Doctor.
You know, I think that life has changed. I think people are going to be wearing masks much more often than they used to, like they do in Asia. You know, when somebody has a cold, they'll be wearing a mask. That's going to become routine because we see that we can transmit agents to other people.
What happens if you had...
I think our culture is going to change.
What happens if you had Omicron?
If you had Omicron, you should be protected against Omicron getting it again, at least for some months, to a high degree, probably not 100%, but there's still Delta around. So we still have a lot of coronavirus around, mostly Omicron, still some Delta.
Gotcha.
Seems like we'll be living with it for quite some time. All right, Dr. Martin Blaser, Director of Rutgers University Centers for Biotechnology and Medicine. Thank you so much for clearing that up.
Yeah, my pleasure. Happy to help.
Okay.